My name is Bex Woods at Brown and Brown Health and Employee Benefits. Now, just a little bit about myself. I've been in this industry specialising in employee benefits for coming up to 13 years now. So this morning, I am just going to give you a brief overview now that we have partnership with BAGMA to offer and try and support and protect your workforce. Thank you, Richard. So, Brown and Brown, we are one of the top 6 in the UK employee benefits brokerage in the UK. Now, we are worldwide, so you may be familiar with the name Brown and Brown. Now, I am the specialist in employee benefits. However, we do have specialists in all sectors of insurance, from general insurance to personal lines. But within the employee benefits side in the UK, we have around about 180 employees now. So we do try to differentiate ourselves here at Brown and Brown from the other brokers in the UK. Now, predominantly, we focus on service. So although we have got expertise and we deal with general renewals and, whether it's cost savings or supporting your employees or, discussing the differences in all the benefits. We have got so many added value benefits in being a client of Brown and Brown. We've got access to over 300 markets when we come in to look at a range of different employee benefits. So with a wide range of markets, if anybody has got any employee benefits in place at the moment, now's a great time, even if it's just to set another pair of eyes to look at your policies. We are in such a volatile market, and we can certainly give you a second opinion, and there is absolutely no obligation and there's no additional cost to our services here at Brown and Brown. Now, within the agricultural industry, now I completely appreciate that on this webinar, we may have completely different types of businesses. So we'll have some smaller family businesses. Most of the companies will be family owned. But if you've got, employees, maybe, 10 to 50 employees, 50 plus employees, hopefully there will be something of relevance to you all within this webinar that I'm going to touch on today. Now, we have got some stats from the industry, from a few insurers, and quite alarming. In particular, one of them, 95% of UK farmers under the age of 40 rank poor mental health. This is something where we can certainly try and support yourselves and your employees with. Now, I appreciate it's not a talked about topic, although it is more common now. Also, another alarming stat that we did receive was 2 times more likely to die by suicide for an employee working in the agricultural sector than the general population. 255 days lost to sickness absence per UK company. Now, another one as well is musculoskeletal issues. However, that is common across all sectors for the musculoskeletal issues. So access to healthcare is, a concern in the UK, in particular for anything that's deemed non-urgent, and it impacts all industries, which is why I'm going to try and explain how the benefits can support today. The majority of people do rely on the NHS. However, there are so many benefits that you may actually have in place now that can certainly support your employees in one way or another. So I will just move on. So employee benefits are in place to try and reduce absence, retain staff, and hopefully prevent long-term sickness. Now, that applies to health and risk benefits. It's not just one particular benefit. There are policies in place that supports all areas of these absences, sickness, retention, or trying to, employ the right, get the right person on board. Benefits packages are very common in what people look for when they're applying for a job. I know, if I was to go and look for a job now, I'd be conscious of my benefits package now and what I would get moving forward. Expansions. So if you've got, a workforce that you're looking to expand on and, trying to retain these staff and trying to grow in the right areas, benefits are a great way to try and help in expansion, recruitment, and growing head count, and HR changes as well. So if you've had any, to pay transfers and maybe them employees have currently got cover and you need support in aligning the benefits following the transfer, that is certainly an area we can support with. Now, the main employee benefits that we offer, they are split into 3 sections. So protection for the agricultural section is probably key, one of the main areas. That is key person cover, which I will explain a little bit more about all of these benefits further along in the presentation. We've got inheritance tax, which I know is constantly spoken about within the farming industry. We've got shareholder protection, personal life insurance, and we also support with workplace pensions, which is something that most businesses have in place now, all businesses. The health side is your benefits such as your private medical insurance. That can be for one person all the way up to thousands of employees. That's UK and international policies. Health cash plans, dental insurance, and your employee assistance program, which is the EAP. And then we've got the risk, which is the group life insurance, may also be known as death in service. That is a really common benefit. Your group income protection and your group critical illness, they're the ways that the employee benefits are split out. And all of these benefits are to try and help with employee well-being. So although they might seem really simple, on there, and I will explain what each of these policy offers. So private medical insurance, that is designed to support employees if they need to seek anything that's not deemed accident or emergency. So if anybody wants or has been referred and needs to see somebody privately, if they have private medical insurance in place, they can go to a private facility, have a specialist consultation, diagnostic test, and get the treatment much quicker than what they would do under the NHS. Please know that the timescales and the demand will depend on each area. So we're not saying you may get an appointment tomorrow, but it might be a week, whereas the NHS, for non-deemed procedures, it might be, just as an example, but hip replacement, that's not going to be done a minimum 6 months, could all the way up to 18 months, depending on the location in the UK. Whereas on the private side, you will be seen much quicker. So when we've done the survey in 2024, healthcare is actually ranked the second highest valued benefit. That is due to people being able to be seen, be diagnosed, and be treated, and hopefully, return to work quicker than what they would do if there was off work waiting on the NHS. As you can see on there, the NHS waiting times are the highest since they began. The average wait time is nearly 15 weeks. prior to 2019. It's doubled. So with regards to any existing members, if you've got private medical insurance in place, whether it's on a personal policy or you've got a company healthcare policy in place, the costs are rising quite significantly in the medical insurance market. Now, we always have an increase due to age. Unfortunately, we all get a year older. We've got medical inflation and usage. So claims activity also have an impact. Now, that's not to say that there are no options. We can't look at the policy. We can certainly review the policy to ensure that the benefits are suitable to your employees or to yourself, and also explore the market. We have got many of markets, as mentioned earlier, that we can explore, do the full analysis to make sure that it meets your requirements. If you've got any personal policies in place and you want to look at a company policy, we can certainly do the analysis. Or if you want to just potentially look at what the cost will be, we can obtain some costings. The rates for new to market are very, very competitive at the moment. Another employee benefit, which is very well utilised, supports employees financially, is what we call a healthcare cash plan. So that gives employees the ability to claim money back against everyday healthcare, such as dental, optical, physiotherapy, osteopath, chiropractor. Also, there is a consultation benefit in there. Within the background of these policies as well, all employees get access to mental health support, to a 24/7 GP service. If your employees have got children, they can add the children at no additional cost to these policies. So even if they just add the children and they utilise that 24/7 GP service, I feel that is probably the most valued benefit in my household, having two little boys. If they fall ill at the weekend or I try and ring my GP, I've got to be on the phone at 8 o'clock in the morning and I'm in the queue. So if I can use that 24/7 GP service, 9 times out of 10, they can either prescribe medication or send me an onward referral if they feel they need to see a specialist. So on the healthcare cash plan, it is a really, really low cost benefit. So the prices are very competitive and the prices start from as little as £6 per month per employee. If employees actively engage, and we can certainly support with communication and presenting to your employees what the cash plan offers, how to claim, what actually each benefit means, where they can claim in each area, then your employees can claim far more back than the £72 a year. They probably will claim back just as approximately, but if it was one provider, they can claim back £90 a year on the dental, just on the lowest level. It's only costing £72 a year for the employee themselves. So the healthcare cash plan, it covers pre-existing conditions. There is no medical underwriting. So providing you're on cover from, just as an example, the 1st of July, you go to the dentist on the 2nd of July, obtain an itemised receipt, you can submit that. There's no underwriting, you'll be covered immediately. So this is a really, growing area and has been for the last couple of years. Another benefit that we offer is a dental plan. The cost of any dentistry is growing quite rapidly, even for a routine checkup, scale and polish, before any restorative treatment. So we can offer policies that offer reimbursement that can be against any dentist, whether it's private or NHS, providing it is a recognised practice. That's when the dental policy can support. You can choose if you wanted to, have a number of employees on there. You don't all have to be on the same level. So you could have maybe directors, senior management at higher level, and all your other employees maybe on a lower level. It is a cost. It is slightly more than a cash plan, but this is a dental policy, so it's covering dental work, whereas a cash plan will give you a maximum benefit per year. This dental policy will cover far more dental work, your fillings, your checkups, your scale and polish, root canals, and anything major for the dental. Okay, so just on the wellbeing side, mental health referrals are the highest records since began. Now, the waiting times are longer than 6 months with the NHS. We've had some quite alarming cases, myself alone, especially in the last 12 months, whereas, I've had some calls directly from employees. I don't disclose any information to the employer. However, we're here to try and support and guide them employees directly, the best way forward, how the policy can support them. And we also communicate with the employers as to mental health campaigns, whether it's, employee facing or employer facing. This is a really, really high claiming area, even if it starts off as outpatient, or people deteriorate, stop engaging, inpatient and day patient services. The waiting time for the inpatient at the Priory Hospital for one employee that I was trying to support was over 7 weeks because of the demand. And that's because the NHS, unfortunately, is not able to support in this area currently. However, it is a phenomenal service, and these benefits do support in a wide range of areas, which I will explain further along. The Employee Assistance Programme, another really low cost benefit, £7 approximately per person per policy year. That is a confidential support 24/7 helpline. It could be financial, could be work-related stress, it could be, legal, maybe your neighbour's built a fence higher than you want and there's a dispute. You can use that employee assistance program for anything when you're not feeling yourself. We've also got access to mental health first aid courses, which we're seeing a huge increase from employers wanted to train line managers in this area. And then another benefit that is quite popular, in particular with company directors, senior management, is health screening. So a full body health assessment, where they just check your blood, your cholesterol, your liver function, your kidney, a wide range of tests. That is a preventative measure followed by a report. And the occupational health is also increasing and in huge demand to try and create a more healthy work-life balance for their employees. Okay, so on the death in service benefit, you may be familiar. If you've got this benefit in place, I will say this is a really volatile market. So if you've got this benefit in place and you want to analysis, you can reach out to ourselves and we can certainly support in this area. 61% of UK employers now offer this benefit. It is a lump sum paid to the beneficiary in the event of a death, providing they are still an employee of the company. Now, you can choose a multiple of salary. The average across the industry is 4 times salary, but should you wish to choose a £50,000 lump sum or 10 times salary, you can do any multiple of salary from 1 to 10 times salary. Within the background of the death in service policy, there are so many added value benefits. Now, these do vary depending on which provider you're with, but most of them do offer a 24/7 helpline. It is an employee benefit. However, these services are also rolled out to their immediate family, so their dependents and their partners. So if you have got this benefit in place, please note you more than likely will have these added value benefits included. All of the providers offer some mental health support. It will be a 24/7 helpline. Some providers also include face-to-face counselling. There is bereavement counselling. Some providers offer funeral concierge. We've got one provider at the moment that offers child mental health support, which, again, is an area that we've never really had any kind of support on the private side, and the NHS does struggle in this area. So if you've got any, teenagers maybe stopped engaging peer pressure, and you have got a death in service policy, please just, reach out to us if there's anything that you need from the added value benefits side. And we can certainly try and help you promote that benefit and provide with communication to your employees as well. So this isn't a P11D taxable benefit, which is why it's so popular. The benefit, it typically covers all employees within the workforce. However, they are very strict on the criteria. So if you said, actually, we just want to cover directors and senior management, that would be absolutely fine. And with regards to the benefit itself, you don't have to all have the same level of benefit. So you can vary the benefit. You can have separate categories. You can have 1 time salary, or you can have directors on 5 times salary. Group critical illness is another benefit that we support with. That is a tax-free lump sum, and that is paid to the employee. Now, we can offer this benefit for 2 or more employees. So this would be payable if an employee has been diagnosed with a particular illness, subject to the terms and conditions of the policy. However, if your employee has been diagnosed with cancer, but they're still actively at work, the group's critical illness would be still payable. You can choose a fixed amount or, again, a multiple of salary. On the critical illness side, it is more popular to have a fixed amount. That is what we tend to see. And like I say, the employee doesn't need to be absent from work. What the employee does with that lump sum would be entirely up to themselves. They might save that to cover the mortgage or their everyday cost of living, or they might think, actually, I've got a bucket list that I want to try and achieve. And they might, book a once in a lifetime trip to a safari in Africa. That's entirely up to their employees. Whereas group income protection policy, sometimes it gets a little bit mistaken with a group critical illness policy. A group income protection policy is a benefit to support your employees when they've been absent on long-term absence, so they're not able to work due to illness or accident. Now, this policy usually kicks in following a set number of weeks off work. It is usually 13 weeks. A couple of providers do offer 8 weeks, and some companies say, actually, I don't want this benefit to kick in until, the employee's been absent for 26 weeks. So that would cover a percentage of the salary. We can't offer more than 80% of salary because we want to try and encourage your employee to come back to work. There is a rehabilitation service. There's an early intervention team for all insurers who will help employers manage the workplace absence and try and get your employees back to work or prevent them going off. And so this is a really, really valuable benefit. The most common claim on the group income protection side for long-term absence is cancer, and that accounts for over 66% of the income protection claims back in 2023. Okay, so on the protection side, the business protection. So in the agricultural sector, this section is probably one of the most valued benefits. You've got key person cover. So it's very much like a policy where it covers the employer. So if you've got an employee, they don't have to be a director of the business. You might just think, actually, we've got a top salesperson within the business that the business would be at a loss if they was to go on long-term absence. This key person cover provides a cash injection to the company. Now, it could be to pay, for recruitment. It could be to repay outstanding debts, loss of profits. That's where the key person cover can support your businesses. On a key person cover, if you have got something in place, we would just encourage you to have a look at the policy. If you do want another pair of eyes, we have got a dedicated specialist who's very experienced in this industry, who can certainly support and give you the best advice. Normally, when these protection policies are in place, they're put in place and not typically reviewed. Times change, values change. What we don't want to happen is the point of claim, you come to claim and it's not worth the paper it's written on and it doesn't cover much. So please reach out in this area if you do need any kind of support. Shareholder protection is another common benefit. That just helps businesses keep control of the company. So if, like myself and my sister was in business together and we had 50-50 share of the business, and then I suddenly passed away, and then my shares might go to my husband. He's got absolutely no clue whatsoever as to run a hairdressing business, as an example. If me and my sister, he could then completely go and sell it to one of our competitors or run the business into the ground. Whereas if I had shareholder protection in place, that would allow my sibling to buy the 50% of my shares off my husband in the event of anything happening. Relevant life cover. This is a life insurance policy. It's just a tax efficient way of offering cover to business owners and employees. So yes, there is the death in service for wider group schemes, but if you're looking for relevant life cover for an individual, then the relevant life cover is the policy that you would need. So premiums are paid by the company. They are classed as a big business expense. And the benefit is tax-free. It is paid to the nominated beneficiary at the discretion of the trust. And then the other policies that we've got in place, the life insurance policy, and then we've got the inheritance tax liability insurance policy. So that's policies designed to cover liabilities associated with gifts. I know that this is a really common topic within the farming industry. If anybody does want any costs for inheritance tax or guidance on a policy in order to support and protect their inheritance tax, please reach out, and this is an area we can certainly support with. And that's myself done. Thank you.